Bismillahirrahmanirrahim. It is Sunday and early morning, 6 a.m. and we are going to discuss a very important, extremely useful AI prompt engineering. What is prompting? Process of giving instructions, questions, or cues to an AI model like ChatGPT, Claude, or Gemini to guide its response. That is called a prompt. It is basically like a conversation starter or command which tells AI what role to take, what task to perform, and how the output should look. The better and clearer the prompt, the more useful and accurate the AI's answers will be. So the basic thing is asking the right way in prompting. As it is said that if you want something, ask for it. It is as simple as that. But the right way for asking is a skill, crafting instructions that help AI give meaningful, relevant, and structured answers, and no bluffing. So we use which frameworks and why they matter. Clinical Reasoning Framework SOAP SBAR to structure patient care, prompt framework structure AI interactions for better outcomes. The cognitive load theory connection. Unstructured prompts will lead to high cognitive load and poor AI performance. Structured prompts will reduce ambiguity and give precise, relevant outputs. Health profession education, we need AI that maintains clinical accuracy, respects cultural contexts, follow ethical guidelines, and adapt to diverse learning needs. What are the key elements of a prompt? First is instruction. What you want the AI to do. For example, you want it to summarize this article in 100 words. Second is context, background or detail the AI needs. Example, you are an expert in medical education. Third is format, how the answer should be structured. Provide the result in table with columns, theme, code, and quote, and constraints. Limit the word count, style, or audience. Explain in simple terms for first year medical students. There is a joke that someone gave that explain it as if you are explaining it to a donkey. And that was very funny. But the constraint has to be put whatever one's like the constraint. What are the prompts frameworks? Prompt frameworks, the complete toolkit when you need comprehensive, detailed output gives structural frameworks. For example, race, role, action, context, expectation. Race, you are a, define the role. Action, what has to be done, for context, and I expect expectation. You fill in the blanks of these greenish bars. Example is you are clinical skill instructor. Action design a three-station OSCE on cardiovascular examination for context third year medical students in resource limited setting. Expectation I expect clear rubrics, timing, and equipment lists. Best for curriculum design, assessment creation, and role play scenarios. Other is trace, task, request, action, context, example. This trace template is task that request by action within context similar to example. So write a literature review section that synthesizes telehealth effectiveness by analyzing five recent studies within a rural health care context similar to systematic review methodology. It is best for academic writing, research synthesis, manuscript development. Crisp clarity, relevance, iteration, structure, precision, ethics template is best for quality assurance, peer review, and content validation. Crisp clarity, relevance, iteration, structure, precision, ethics template is example. Evaluate this dash content for clarity, relevance, structure, precision, and ethics. Suggest specific improvements. Example: evaluate this patient case study for clarity of presentation, clinical relevance, logical structure, diagnostic precision, and ethical consideration. Suggest improvements. And, quality assurance, peer reviews, and content validation is achieved through this crisp format. The co-star framework is context, objective, style, tone, audience, and response. The co-star framework context provide background information to help AI understand the specific scenario. Objective clearly define the task to direct the AI's focus. Style specify the desired writing style to align the AI's response. Tone set the tone to ensure the response resonates with the required sentiment. Audience identify the intended audience so the AI can tailor the response accordingly. Response define the format of the response to get structured, useful output. So, here is an example. I work in a non-profit organization. This is a context, and I have been asked to write an electronic direct mailer informing people about climate change objective. Write this in the style of popular lifestyle publication style, keeping the tone informal and friendly tone. This will be read by audience residing in Pakistan. Audience. I need this to be about 350 words long, broken up into paragraphs of 100 words each, and with a call to action to sign up for the newsletter response. Minimalist frameworks for quick, effective interactions are one of the example is tag, task, action, goal template. Tag task, action, goal. Task by action to achieve a goal. It is best for quick summaries, checklists, and brief contents. And pro example is summarize key components Summarize key competencies for rural family medicine by extracting main points to create a study guide. RTF or Role Task Format Template. Role Task Format Template as a role task in format. It is for professional correspondence and formal documents. As a program director, write a recommendation letter for a resident in formal academic format. APE Action Purpose Execution Template. APE Action Purpose Execution Template is best for patient education material and quick reference guide. For example, is create visual infographics for patient education about diabetes management through simple icons and bullet points. Reflective frameworks for professional development and critical analysis are like care, context, action, result. Care is basically best for teaching, portfolios, CPD documentation, and reflective practice. Care, for example, in a challenging bedside teaching movement, I use the 1 minute preceptor model resulting in improved student confidence. For instance, when teaching heart murmurs assessment. So it is care, context, action, result. Example. Another one is STAR stimulation, task, action, result template that is best for leadership development, problem solving, and documentation. Star format, for example, is situation, low student engagement in online lectures, task, increase participation, action, implement interactive polls and breakout rooms, result 80% participation increase. Spear, situation, problem, exploration, action, result, template. Spear is best for critical incidents, complex problem solving. In our simulation lab, equipment failure emerged. I explored backup options and alternative scenarios, implemented low fidelity alternatives, achieving full session completion. Narrative frameworks for storytelling and persuasive content. BAB, before after bridge template. BAB is for change management and implementation stories. Initial state before, desired state after, bridge transition process. For example, before traditional lectures with passive learning, after interactive case-based sessions with active participation, bridge gradual implementation of problem-based learning methodologies, BAB, before after, bridge template for change management and implementation stories. There is another format, AIDA, attention, interest, desire, action template, attention, hook, interest, relevance, desire, benefit, action, next step. For example, attention, medical errors cause lives, interest, simulation training reduces by 60%. Desire, your students deserve the best preparation. Action, join our simulation workshop series. It is best for grant proposals, conference presentation, and marketing. We have another format, problem, agitation, solution, template, problem, issue, agitation, consequences, and solution, intervention form. It is used best for public and for policy advocacy, needs assessment, and problem identification. So PAS, problem, agitation, solution. Example is problem is that medical students lack cultural competency training. Agitation, this leads to health disparities and poor patient outcome. Solution, integrate community-based learning experiences. Advanced techniques for complex reasoning and multi-step processes. Chain of thought code template. Chain of thought is think step by step, step one, two, three, step three, and therefore conclusion. This is a chain of thought. Chain of thought is used for complex planning, systematic design, and logical reasoning. An example is that design a clinical reasoning curriculum step by step. Number one, identify learning objectives. Two, map to competency frameworks. Three, select appropriate cases. Four, create assessment rubrics, therefore ensuring systematic skill development. Now you can see you can give a step-by-step chain of thought template and the complex planning and systematic design and logical reasoning will follow. Generated knowledge prompting template is first generate background and knowledge, then use this to main task. What it is used for? Generated knowledge prompting is used best for knowledge synthesis and comprehensive learning. For example, first generate a list of key cultural considerations in mental health care, then use this to design a cultural competency training module. Another template, React Reasoning Acting template, best for evidence-based practice, iterative improvement. Reasoning students struggle with clinical decision making, action, implement case-based learning, observation, improved critical thinking scores, reflection, active learning enhances clinical reasoning, react reasoning and acting. You can see the template, reasoning, analysis, action, implementation, observation, result, and reflection, learning. So smart framework selection is requires a quick decision, and when your primary goal is quick information, you go tag RTF and APE. When you want complex planning, you go for race, trace, and code. When you want professional growth, go for care, star, and spear. When you want persuasive content, you go for AIDAP, AAS, and DAP. You want for quality assurance, you go for CRISPE. So this is the summary of the prompts that you get to go with depending upon what is your primary goal. There are some advanced prompting strategies like prompt chaining, link multiple frameworks for complex tasks like step 1 use race to define role and context. Step 2 apply code for systematic reasoning. Step 3 implement CRISP for quality check. So this is linking multiple framework for complex tasks and it is so beautiful. The essential five master these first. Race role based structured task, tag quick simple requests, care professional reflection, code complex reasoning, and grace for quality evaluation. The fantastic five or essential five or master five. The five framework families review. Structural arrays trace crisp for complex detailed tasks. Minimalist tag RTF APE for quick efficient requests. Reflective care stars peer professional development. Narrative ADA pass BAP for storytelling and persuasion. Advanced Court-generated knowledge, React, and complex reasoning for these and these are used. There are some emergency copy paste ready prompts like quick summarize topic in 5 key points for audience. Role assignment you are a role action for context. Step by step explain step by step how to dash task. Quality check evaluate this content for clarity, accuracy, and ethics. These are the emergency prompt, copy paste ready prompts. Prompt crafting in action. Three real examples. Example 1, the curriculum designer. Challenge. Design a cardiology rotation for resident. Poor prompt. Problem. Too vague. No context. No outcome specified. This is not a good. No excellent prompt would be like this. Race and court. You are experienced cardiology educator and curriculum designer. Create a 4 week cardiology rotation for internal medicine trainees in a tertiary care hospital setting. Think step by step. First, identify core cardiology competencies for internal medicine. Second, map competencies to weekly learning objectives. Third, design clinical experience and assessment. Fourth, create a balanced schedule. I expect weekly learning objectives aligned with ACGME competencies, mix of inpatient, outpatient, and procedural experiences, assessment methods and schedules, resource requirement and constraint. Context 50-bed cardiac unit with two attending cardiologists, cath lab access, residents rotate in pairs, 80 hours work week limits. Why this works? It gives clear role, specific context, step-by-step reasoning, detailed expectation, and realistic constraints. There are no out-of-the-world constraints in this. Example 2, the assessment creator. Challenge: create practical exam without resource-intensive OSCEs. Poor prompt: create an exam for clinical skills. It will lead no result. However, an excellent prompt will be trace and crisp. Trace task, create innovative practical assessment for physical examination skill. Request design resource efficient alternative to traditional OSCE. Action: develop hybrid assessment with virtual patient and peer evaluation. Context: 120 third-year medical students, limited faculty time, assess cardiovascular, respiratory, and abdominal examination skill. Example: similar to virtual OSCE models but with inpatient components. This is the trace prompt, and the CRISP is for evaluating your design. Clarity assessment format clear to student and faculty? Question mark. Relevance assess intended clinical skills? Question mark. Structure logically organized? Question mark. Precision specific measurable criteria? Question mark. Ethics fair and accommodating to diverse learners? Question mark. Include rubrics, timing and implementation steps. Why this works? Complete task definition, built-in quality evaluation, and specific deliverables. Example 3, the reflective educator challenge. Learn from a difficult teaching moment. Proven prompt. Excellent prompt is care plus pair. Care. Help me reflect using SPARE framework on this teaching challenge. Situation during bedside round. A student challenged by antibiotic choice in front of the patient. Problem: appropriate academic question, inappropriate timing or setting potentially undermine patient confidence. Exploration: how to encourage critical thinking while maintaining professional boundaries and patient trust. Action: what specific strategies should I use next time? Question mark. Result: what outcome indicates successful handling? Care, context, contributing factors to the situation, action. What? I will do differently next time. Result expected positive outcomes. Example specific scenarios for future similar situations include consideration for patient care, educational value, and professional development. Why this works? Use a complementary framework, specific situation, requests, actionable outcomes, context specific recommendations. In health profession education, when you are planning curriculum, you go for race and card because role clarity and step by step logic. For research writing, trace and crisp because they are comprehensive, context and quality driven. Teaching reflection, care and spare experience focused and deep analysis. Student assessment, star and crisp structured evaluation with quality assurance. Grant writing AIDA plus PAS persuasive structure with problem focus. Policy development PAS plus CORD problem identification with logical reasoning. There are other advanced crafting of prompt techniques. Technique one is the layered approach. Start with basic framework, then add layers. Basic framework is the race, role, action, context, and expectation. Cultural layer, consider diverse population. Plus, ethical layer, ensure patient privacy and context. Plus, practical layer, account for resource limitation. Plus, evidence layer based on current best practices. So, the layer adding technique. The second technique is constraint challenge, a realistic limitation for practical solution. Designed with these constraints, maximum 2 hour faculty time, budget rupees 500, space one classroom and 40 student and technology, laptops only. Technique 3 framework combinations. So you can go for prompt quality checklist before submitting by prompt verify the five essential elements role clear who AI should be, context, specific situation and constraint, outcome, defined success criteria, format, request, output, structure, ethics, privacy and bias consideration, quality assessment, rate 1 to 5, clarity is request specific and unambiguous. Context is the background, complete and relevant actionability. Are outputs implementable? Completeness. Are all requirements included? Ethics. Are considerations addressed? So the total score of 25. And 20 to 25, it is excellent, ready to use. A 15 to 19, good with minor refinement. Periods 10 to 14 needs improvement and below 10 needs start over for prompt quality checklist scoring. You are prompted a tablet copy and customize for curriculum development, for assessment criteria, for professional reflection, for innovation projects, and for common prompting mistakes to avoid. The generic request trap, the context-free problem, the one-size-fits-all issues. Don't use same framework for every task. Do mesh framework to task complexity and purpose. The constraint blind mistake. Don't ignore practical limitations and do include realistic resources, time and space constraint. Pro tips for medical education prompting is that always include learner level, year experience background, learning objective, clear measurable outcome, context restraint, resources, time, cultural factor, competency alignment, WAF, BPM, DC, SEJME, LCME are relevant standards, ethical considerations, privacy bias, cultural sensitivity, framework selection strategies, simple task, minimalist frameworks, tag, RTF-AP, complex planning, structural frameworks, race trace, professional growth, reflective frameworks, care stars, peer, innovation or change narrative frameworks, AIDA, PAS, and BAP have multiple step problems, advanced technique, got hand. react. So success formula is excellent prompt is equal to right framework with a rich context, with clear expectation and ethical awareness. Quick reference card, framework selection guide, quick task, tag RTF APE, complex projects, race, trace, caught, reflection, care stars, spear, persuasion, AIDA, PAS, and BAP. Quality check with Chris. Post-lecture checklist. Review the three detailed examples. Identify your top three for frameworks for common tasks. Complete the quality checklist practice. Ethical guidelines are frameworks using AI. UNESCO recommendations on ethics of artificial intelligence 2021, the first ever global standard for AI ethics, formally adopted by all member states, aims to ensure AI serves humanity, society, and the environment responsibly in UNESCO 2021 recommendations. Then there is guidance for generative AI in education and research updated in April 2025. This guidance offers a human-centered approach to implementing generative AI, Gen AI, in learning and research environment. HEC has its own as a framework for ethical use of generative AI, and this policy lays out how higher education institutions in Pakistan can responsibly use Gen AI tools like GPT-3, ChatGPT for teaching, learning, research, and administration. HEC policy balances innovation with ethical standards, focusing on transparency, concept, fairness, data privacy, academic integrity, and explainability. Transparency, disclose AI involvement, fairness, mitigate bias, accountability, humans remain responsible, data privacy, protect sensitive information, academic integrity, avoid plagiarism, ensure originality. So addressing misconceptions, AI will replace teachers, while reality is AI is a tool. It will assist educators, it will help the teachers, and it will never replace them. Key takeaways. Key takeaways are that AI is the best thing to use in proper frameworks with a better prompting and ethical responsibility.